Have you ever wondered why your butt is still flat despite doing all the exercises for your glutes? Or have you ever wondered why you can't feel your glute muscles? My name is Dr. Jocelyn Conley. I'm a pelvic floor physical therapist and co-founder of the Vagina Docs. And in this video, I'm going to talk to you about why your butt is still flat and why you don't feel your glutes. First of all, a lot of people that I know and my patients, when they train their glutes, there's no intention. They just go from A to B and they just squeeze their glutes at the top. The problem with this is that the glutes act as primary hip extensors, meaning you go from hip flexion to hip extension, and when you just push through your feet, your body is just going to get from A to B in the most efficient way as it can with the least energy expenditure as possible. It is cheaper to use your hamstrings than it is your glutes. It's kind of like you pay $2 to use your hamstrings versus $20 to use your glutes. Your body is for sure going to use the $2 currency versus spending $20. Another problem that I see is when people are training their glutes, they're mainly training them in one plane versus learning how to utilize their glutes to control motion and to drive motion in the transverse, or this plane, the turning plane, and then also the frontal plane, or the plane like this. So I want to teach you 3 different exercises that you could do to start changing the shape of your glutes. The first exercise I'm going to show you is the something that involves hip rotation. The go-to exercise that people utilize is either the clamshell or something like the stinky leg. Clamshell looks like this, laying on your side and opening up the hip like this. The problem is, most people that I assess doing this motion, they're not actually moving efficiently, or they're not isolating the rotation. They move from down here as opposed from up here. So here's the exercise I suggest doing. This exercise will teach you then how to perform the clamshell or the stanky leg exercise and actually utilize what you're using. First thing you're going to do is you're going to ground through your standing hip. You're going to take a step out, whether you have a band or not. Tighten your butt cheek on the standing leg to unweight, to stabilize through your hip, and then also so you can unweight your opposite hip. Then you're going to rotate your opposite leg without turning your whole body. As you do that, you're ignoring your foot. Your foot's just going for the ride. You're just rotating through right here where the femur meets the ball and socket joint. As you do that, you're going to squeeze your glutes, and your target is to feel this deep in the hip. Those are your deep glutes working to rotate your hip. Now that you've felt that there, you can either keep going or you can take it a step further and then lay on your side, knees and hips, ankles and knees are stacked, pelvis is rolled forward. You're going to rotate your hip through the ball and socket joint. As you rotate, you're going to squeeze your glute gently or squeeze your butt cheek gently. Keep your bottom leg completely relaxed. As you do this, hold the rep, hold for 5 seconds, and then control back down. There should be no counter rotation and minimal push from your bottom leg. The key to both of these exercises is to stay connected to your deep core. So gently pull your belly button in towards your spine, take up the slack in your pelvic floor. If you don't know what that means, comment below. And that is going to be your anchor point so not everything rotates. Second exercise is going to work the hip in the frontal plane. If you have a box, great. That we're going to utilize that. But before we get there, here's your awareness drill. Same setup as you did with the clamshell, but now top leg's going to straighten. Soften your knee, rotate through the hip without rotating through your pelvis. As you rotate through the hip, you should feel this in the same region as you felt the other exercise, the clamshell. Right about here, maybe a little bit higher in your back pocket. From here, soften your knee. You're going to gently lift your leg up, hold, and then gradually control back down, not allowing your hip to lose the rotation. So again, you're going to rotate your hip, keep it there. Feel that. You just did that with the banded exercise and with the clamshell. Then you're gonna raise without tilting your pelvis. The space between your ribs and your pelvis stays the same. Hold upwards of 10 to 30 seconds, control back down. You should feel this here. Now, if your back's super arched, you gotta connect to your deep and your outer core to keep your ribs connected to your pelvis. So you felt that there. Now, what you're gonna do is called the eccentric hip drop. So you're gonna shift your weight onto one leg, drop your right side, and then you're gonna squeeze your butt cheek on this left side to bring your hip back to level or slightly up. Now the key is, this is all coming from this side. You feel it in the same spot as you just did this. I don't even like calling it Jane Fonda, but apparently that's what the rest of the world calls that exercise, but the Jane Fonda. From the side, I'm just dropping, my knee stays straight but soft, and then I lift. Again, I'm staying connected to the deep core. So that's the second pair of exercises to work the hip in this frontal plane. The third exercise is a combination, it's more complex. It's called the dynamic half moon. So we build in the Romanian deadlift or the single leg hip hinge to a rotation. So first thing I'm gonna do, and I'll give you a couple views, feet underneath hips, I'm gonna shift my weight, squeeze my glute back to align my back leg with the rest of my body. I'm gonna tip for my hip, spine stays in neutral the whole time, shoulders and hips stay square. I'm gonna squeeze this glute in the leg that's grounded to open my whole body up. So I'm moving through my hip, but my whole body's moving. I can open my arms up, and then I'm gonna close down, and I'm gonna repeat. The dynamic half moon. If you take a look from the front, my knee stays facing front. I'm not letting it collapse like that, I'm pressing out. My glutes on this side is driving hip rotation. This is why my butt looks so good. It's because I do these rotational exercises. I work the glutes and all the different planes. I don't have to worry about the flat butt syndrome that comes from just doing hip thrusts and just glute bridges. I incorporate all these other planes, so I got the side butt, the shape. You can too, but now you got to incorporate these other exercises in your training. Still good to do other movements like deadlifts, single leg RDLs, which I showed you. It's great to do hip thrusts, bridges, all of that are great, but start to include these other exercises. I'll include the links to the full videos of the exercises that I just reviewed in the description. If you have any questions, comment below. Otherwise, thank you so much for watching. I'll see you on the next video.